right. So many people have heard me talking about this already for a long time because I basically became obsessed with this problem of how the declining state of youth mental health, and it's motivating right now a lot of my work and my research. So after a decade or two of improvement in teen mental health, I'm talking about young people, college speakers, things have started deteriorating right around about 2012 or so. Depression prevalence shot up, started increasing. Anxiety started increasing. The numbers of teens showing up in the hospitals for psychological distress, mental health crisis has also started going up in concert. Actually, not just US, these numbers are for US teens. It actually happened in many parts of the world. And also notice actually the gender gap. Situation is actually much worse for girls than for boys. Now, some people may think there's been decreasing stigma around mental health. People are more free to talk about it. The young people like to complain, so they're complaining about mental health. Well, if you look at objective indicators like, taking your own life, things have gotten worse. Eric was quoting statistics before about veterans. Things are really bad for young people as well. Right around 2012, 2014, right? So what happened then? People probably have some. I'll get to that later. Some favorite suspects, and I just want to, as a prelude to the suspects. So I look at what happened actually during the pandemic. So this chart is showing again looking at hospital visits for mental health distress for mental health crisis. You had before the pandemic is showing the number of kids, up to 18 years of age, separated by gender. Going to the hospital during the school year, you have higher admission rates. During summers, things improve. Then COVID strikes. Nobody's going to the hospital. People are families are handling their problems at home. And after the pandemic, girls shot right back where they were before. Girls and boys stayed, there's something about the pandemic that is protective. Now, if you have sons actually at home, you probably have a pretty good guess of what is protecting and boys. It's the algorithms. What are boys doing at home? Hmm?
Games.
Playing games, right? We have game balance algorithms that make sure everybody match to people who have their level of experience and expertise and everybody can have a good time. What are algorithms doing for girls? Making them feel worse about it, matching them to influencers.
Followers.
Exactly. This is what I'm going to be talking about. My research is looking what are we as technologists, we as people who educate students and them out to work for companies like Meta and X and others. What they're designing technology that make people feel bad about themselves. And so there's actually, so it's really social. I believe there's still lots of controversy, but I do believe social media algorithms that are harming mental health. And my research group, we're looking at different pathways to doing this. I'm just going to focus on the two of the three ones. But in general, there's kind of lack of safety online. There's lots of bullying and lots of harmful behaviors people see, but also negative social comparisons are extremely important. There's various ways that social media enhances and puts people in position to have negative social comparisons. And also something people are not talking about is actually social dynamics. Social media just, instead of, we were talking earlier, so before, people were really limited, their interactions were limited to their tribe, to their social groups. Right now, social media has allowed people to interact worldwide and this enables fundamentally new social interactions that are also hijacking our evolved mechanisms of recognizing who our friends and foes are. I have my own theories, but we are studying some of these, and I'll talk about some of these mechanisms. So let's see. Negative social comparisons, what are the mechanisms through which they happen? Well, people online present an idealized version of their lives. They select certain moments and then non-representative moments about their life, and then they display them to others. On top of that, if that wasn't bad enough, algorithms now compile a list of these kinds of moments that others people have reacted to, and they present it to you. So you end up seeing even less representative samples of your friends' lives. On top of that, and this is what we've been studying, actually, social network structure can amplify negative social comparisons, putting people through mechanisms like the friendship paradox, where your friends are more popular than you are, and it happens for everybody. It makes allows influencers to have an outsized effect in setting destructive social norms. But besides the social networks and the social dynamics is also important. Actually, this is an interesting case study about rapid onset of functional tick-like behaviors where they just blew up among girls during the pandemic. And then it took, doctors were comparing notes worldwide, and they traced basically the fact that people were having the same verbal tics in Germany, Australia, United States, and they actually traced them back to a few social influencers, social media influencers on YouTube and TikTok that had this. So it actually illustrates this social contagion. What my group is studying is actually eating disorders, which is actually one of the most prevalent, is actually one of the deadliest mental health conditions among the young people. It's only second to opioid addiction in its harmfulness. And I do believe that social media is amplifying eating disorders. This is showing how during pandemic, eating disorders exploded among the young girls. Situation was so bad, there were like 4 months, 5 months long wait lists to get help for these things. And there's also evidence, this is not our work, this is from Network Science Contagion Institute, that's showing the amount of content online that's tagged with eating disorder, promoting eating disorders, promoting actually suicidality and self-harm. It also has been growing basically exponentially. So what I'm trying to understand is things that we're studying right now is that social media creates this social mechanism that promote these vicious cycles. In many cases, it can be virtuous cycles, but in many cases, they're vicious cycles. Harmful content is easy to find, and people link to like-minded others to create echo chambers that normalize and amplify these behaviors, allow people to produce more harmful content for others to find. This is actually a very similar process to, for example, online radicalization. And to get more details about these harmful cycles, vicious cycles, and how we're using large language models and AI to understand them, actually, you'll see David. Raise your hand, please. David will present the poster on that. Right, thank you.